Can PET scans accurately diagnose different types of dementia? Imagine a tool that can help doctors see inside the brain and understand what kind of dementia a person might have. Positron emission tomography scans, especially using a type called fluorodeoxyglucose or FDG PET, are quite good at doing this. They measure how the brain uses glucose, which is its main energy source. Different types of dementia cause specific patterns of brain activity to change, and FDG PET can spot these patterns. For example, in Alzheimer's disease, there is often reduced activity in the areas at the back and sides of the brain, called the temporoparietal regions. In frontotemporal dementia, the front parts of the brain show less activity. Dementia with Lewy bodies tends to affect the back parts of the brain, and vascular dementia shows a more patchy pattern depending on blood flow issues. Research shows that FDG PET can correctly identify these different patterns about 80 to 90% of the time. Its ability to distinguish between types of dementia is also very high, with specificity often reaching 89 to 100%. This means it is very good at ruling out other conditions when a specific type is suspected. However, PET scans are not used alone to diagnose dementia. They are a helpful addition to a full clinical assessment that includes medical history, cognitive tests, and other imaging like MRI scans. Recent advances have made PET scans even more powerful. Artificial intelligence tools now analyze these scans and can identify 9 different types of dementia with about 88% accuracy. This helps doctors make faster and more precise diagnoses. Besides FDG PET, there are special PET scans that target proteins called amyloid plaques and tau tangles, which are hallmarks of Alzheimer's disease. These scans can detect abnormal protein buildup in the brain, often before symptoms become severe, and are useful in diagnosing early or in clear cases. They also help determine if a person might benefit from new treatments that target these proteins. In summary, PET scans, especially FDG PET and those that look for amyloid or tau, are very useful tools in diagnosing and telling apart different types of dementia. They improve the accuracy of diagnosis, help predict how the disease might progress, and guide treatment options. But they are part of a bigger picture, including medical history, cognitive testing, and other scans. If you or a loved one are concerned about dementia, it's important to talk to healthcare professionals who can recommend the best approach based on individual needs.